In 2016, around 2.8 million deaths worldwide were attributed to alcohol consumption, making it the seventh highest risk factor for disability and early death. Alcohol consumption is among the leading cause of illness, death, and injury worldwide. Its use has been linked to a number of communicable and non-communicable diseases, intentional and unintentional injuries, as well as mental illness. Alcohol use can be classified as a necessary cause for disease, a component cause for other diseases, as well as a factor directly attributable to injuries. Alcohol has been identified as a necessary cause for a number of diseases, meaning that it must be present as a component cause alongside any other cause in order for them to occur. In North, Central, and South America, deaths due to disease where alcohol was a necessary cause represented around 1.4% of all-cause mortality. The most impactful of these diseases on health include alcohol use disorder and those that affect the liver. Alcohol use disorder is characterized by either dependency on alcohol or alcohol abuse, often by overconsumption. Alcohol use disorders have been attributed to high amounts of disability globally, and in 2016 were responsible for around 18.5 million years of life lost due to disability. The effect of alcohol in the liver can take form in various levels, which include fatty liver, cirrhosis of the liver, and hepatic failure. In the early 2000s, liver cirrhosis and failure caused 1.1% of all deaths in the United States and was the 12th leading cause of death. Other organs and systems directly affected by alcohol include the stomach via alcoholic gastritis, the heart through alcoholic cardiomyopathy, and the nervous system through alcoholic polyneuropathy. Alcohol has been identified as a component cause in many of the most common communicable and non-communicable diseases present today. In terms of non-communicable disease, excessive alcohol consumption has been attributed to various forms of cancer and cardiovascular disease. In cardiovascular disease, alcohol is a component cause and impairs certain functions within cells, leading to the buildup of plaque in the arteries. Alcohol can also disrupt arterial vascular function and cause hormone imbalances that control blood pressure. When blood pressure is significantly affected, it can cause stress in the heart and over time can lead to other diseases. The biggest detriment to cardiovascular health from alcohol is the impairment on the endothelial layer in the blood vessels, as it acts as a cascading effect towards arteriosclerosis and other cardiovascular effects. Endothelial dysfunction has been observed in people who have stopped drinking alcohol after a long moderate history with it, and after single episodes of binge drinking. Oxidative stress in vascular walls have also been attributed to drinking, as the body becomes less and less able to detoxify the substances ingested and fight off the harmful effects. Alcohol consumption has also been shown to cause a linear increase in the relative risk of cancer development. Common types of cancer associated with alcohol consumption include lip, oral, throat, colon, and breast cancer. Alcohol has been identified as a carcinogen through ample evidence provided by animal studies, as well as through research surrounding the differences in genes associated with alcohol metabolism and the suggestion that certain byproducts produced from it are carcinogenic. Around 389,000 cases of cancer per year alone can be attributed to alcohol consumption worldwide, constituting around 3.6% of all cancer cases. For breast cancer in particular, it was shown that there was a 60% increase in cancer risk for women who consume more than one alcoholic drink a day. Alcohol has also been noted as a risk factor towards increasing the susceptibility of individuals to communicable diseases. HIV and AIDS, tuberculosis, and pneumonia are all infectious diseases whose risk of development in people and populations increases with alcohol consumption, especially for those in lower-income countries. One of the main ways alcohol increases the risk of infectious disease development is through the weakening and negative effects it has on the immune system and its cells. Alcohol consumption has also been related to risk-taking behaviors and poor living conditions that increase one's susceptibility to infectious diseases. It was shown that for every 10 to 20 grams of alcohol consumed per day, the risk of developing TB raised by 12%, and for pneumonia, there was an 8% increase in risk. In terms of neuropsychiatric disorders, which encompass both mental and neurological health factors, alcohol consumption is easily one of the greatest impacts for alcohol dependence. Additionally, alcohol consumption is shown to be highly related to all mental disorders, including anxiety and depression. However, the causality is not yet clear with respect to these associations. Among suicide victims, alcohol-related disorders, also known as AUDs, are the most common first diagnosis, with depression being the second most common diagnosis. In North America, AUDs account for 20 to 50% of psychotic disorders such as bipolar disorder or schizophrenia in adults. Increased consumption and misuse can intensify psychiatric symptoms and may also diminish a patient's treatment compliance to psychosocial treatment and various medications. AUDs have also been found to be strongly related to the risk of potentially entering the criminal justice system. Specifically, 75% of adults that have a serious mental or psychotic disorder and have had involvement in the criminal justice system also suffer from co-occurring AUDs. Alcohol consumption is a major risk factor for injuries, both intentional and unintentional. For every 10 grams of alcohol consumption, the odds of non-motor vehicle accidents increased by 1.3, and motor vehicle accidents increased by 1.24. In terms of intentional injuries, Suicide, violence, and self-inflicted violence are among the largest contributed sources. Acute use of alcohol increased the likelihood of suicide attempts. The risk of violence and assault after consuming 5 alcoholic drinks was shown to increase. For self-inflicted violence, it was shown in studies that people had a higher perceived pain tolerance. For unintentional injuries, drowning, falls, and fires were the leading causes related to alcohol consumption. Alcohol consumption associated with recreational aquatic activities significantly increased the risk of drowning. Alcohol was detected in 30 to 70% of people who drowned, and it suggests that even small amounts can increase the risk. For falls, there has been found to be a direct correlation between alcohol blood concentration and higher risk of craniofacial injuries, as well as increased risk of injuries overall. While for fires, it was found that 58, or over half, of all fire fatalities were found to be under the influence of alcohol, and with 31% of the total sample having more than 0.2 milligrams per 100 milliliters within their blood content.